In this video, you will learn patient education and teaching for furosemide. Before we start, check the description below for free sources to help you become a nurse and pass nursing exams on your first try. Also, stay at the end of the video to complete a 3-question quiz to test what you learned at the end of the video. Let's begin. For patients taking furosemide, patient education and teaching are crucial aspects of therapy. Patients who are informed about their medications are better able to comprehend its benefits, risks, and necessary safety measures. Following are important components of patient education and teaching for patients using furosemide, along with their rationales. Inform the patient of the rationale behind their prescription for furosemide. Describe its function as a diuretic drug that aids in the body's removal of excess fluid, lowering symptoms like edema or shortness of breath. This understanding helps patients recognize the purpose and benefits of taking furosemide as prescribed. Give detailed directions on how to take furosemide, together with the dosage, frequency, and timing that are advised. Emphasize the importance of following the prescribed schedule to maintain consistent therapeutic levels of the medication in the body. Inform patients of any possible side effects from furosemide. Increased urination, electrolyte imbalances, lightheadedness, or headache are examples of common adverse effects. By being aware of potential side effects, patients can monitor their symptoms and promptly report any concerns to their healthcare provider. Explain the importance of maintaining fluid and electrolyte balance while taking furosemide. Furosemide works by encouraging diuresis, which aids in the body's removal of extra fluid. To increase the medication's efficiency in lowering symptoms like edema, shortness of breath, or fluid overload, fluid balance must be maintained. Patients can actively participate in managing their disease and improving treatment outcomes by being aware of the significance of fluid balance. Emphasize the need to follow any dietary modifications, such as a low-sodium diet, as prescribed. A low-sodium diet helps the drug work better by lowering the total amount of salt consumed. A low-sodium diet can help patients improve the efficacy of furosemide in lowering fluid retention and better controlling their illness because salt contributes to fluid retention. Discuss the importance of monitoring fluid intake and output, as well as signs of dehydration or electrolyte imbalances. Furosemide's diuretic effect can lead to increased urine production, potentially resulting in fluid loss. Explaining the importance of monitoring fluid intake and output helps patients recognize the need to consume an adequate amount of fluids to prevent dehydration. Adequate hydration ensures optimal bodily functions, supports overall well-being, and helps prevent complications associated with dehydration. Emphasize the importance of adhering to the recommended dosage of furosemide and not skipping doses. Explain that consistent medication adherence helps ensure optimal therapeutic effects and prevents complications related to fluid overload or inadequate diuresis. To avoid any potential interactions with furosemide, emphasize the importance of telling your doctor about all of your prescriptions, including over-the-counter drugs, dietary supplements, and herbal remedies. This knowledge helps prevent adverse effects and ensures the safe and effective use of medications. Educate patients about safety precautions while taking furosemide. This includes rising slowly from a seated or lying position to minimize dizziness, avoiding excessive sun exposure, and recognizing signs of adverse reactions, such as skin rash or difficulty breathing. Encourage patients to seek immediate medical attention if they experience any concerning symptoms. Mini quiz. From here, you will answer 3 questions to reinforce your learning. Starting with the first question. Why is it important to inform the patient of the rationale behind their prescription for furosemide? This is to help the patient recognize the purpose and benefits of taking furosemide as prescribed. Next question. True or false? Educating patients about safety precautions while taking furosemide include rising slowly from a seated or lying position to minimize dizziness. This is true. Last question. Fill in the blank. Explain that consistent medication blank helps ensure optimal therapeutic effects and prevents complications related to fluid overload or inadequate diuresis. The answer is adherence. In the next video, you will learn the evaluation and desired outcomes of furosemide. If you enjoyed this video, please like and subscribe for more. Thanks for watching.